Once the blocks are created, recipient sites are usually made before the case is started. I choose to do this because I firmly believe that not only does it give us a finite graft count goal for the day, but it also helps to pre-prime the wound bed by bringing in chemotactic factors and by allowing growth factors to lay down in the recipient beds and allow for a supercharged bed to lay these free tissue grafts in as the case comes to conclusion. Once those recipient sites are made, the patient goes into the robot. Robot dissections usually occur, or usually have a duration of anywhere from about 25 minutes on up to a couple hours. It depends really on the size of the case. This is a very comfortable position. There's been several modifications in the chair that allow for patient comfort, both in their lumbar spine and in their face, where they're sort of in a position where they're laying on their face on a memory foam pillow. The dissections occurs, and a period of about 5 minutes afterwards is designated for manual extraction, where we take out the grafts. Now, during the dissection process, there is a team member, a technician, that is beside the patient who is manually extracting, but we do spend about 5 minutes just to go back over that area at the end and make sure that all the dissected grafts have been extracted appropriately. At that time, the patient is cleaned and the donor side is dressed appropriately, and the patient has a quick lunch or a snack. There are often times where the patients are started early in the morning and they opt to hold off on eating if they're not particularly hungry, and they may choose to take a later lunch or just simply finish their case and take a lunch that we provide. We'll package it for them and send them home. Next, the case the case continues by putting the patient into the chair in a recumbent position where the patient's sort of at a 45-degree angle. We give them 2 remote controls. One is for the TV and one is for the multimedia center. And they're allowed to play with iPods or iPads, smartphones, or simply relax and catch up on an open Netflix account that we have and we make available to them. The grafts are then planted by technicians, and this part of the process usually takes a couple hours, depending on the size of the case. It can take anywhere from 45 minutes up to about 2 to 3 hours. Patients tolerate the procedure quite well. We take some photographs at the conclusion of the case, we wrap the head, and send the patients on their way. The next morning, I'll call the patients and check on them, make sure that they're doing okay and that they have a clear understanding of how to take care of these grafts, and I'll describe that in the next video.